Scenario: a 36-year-old female who has a lump in her neck. Introduce yourself and take permission. Hello, I am Dr. Salma, one of the surgical doctors working here. May I confirm your name and age, please? My name is Sarah. I am 36 years old. Nice to meet you, Sarah. Today, I've been asked to ask you a few questions regarding your condition. Is that okay with you? Yes, that's fine, doctor. Could you tell me what brought you to the hospital today? I have noticed a lump in my neck, and I've been feeling some discomfort lately. I'm sorry to hear that Annalise, the main complaint. Could you please tell me more about this? How did it start? Did it start suddenly or gradually? It started gradually about a year ago, but it has been increasing rapidly in the last few months. Is this swelling decreasing or increasing? It's increasing, doctor. Is the swelling painful? The swelling itself is not painful. Does anything make it worse? Does anything make it better? It seems to get worse when I'm stressed, but nothing makes it better. 1. Thyroid cancer. Do you notice any change in your voice? No. Any difficulty in swallowing? I do have difficulty swallowing sometimes. How about your breathing? Is there any change? No. Do you have other lumps in your body? No other lumps. 2. Hyperthyroidism. Do you have any changes in your mood or sleep patterns? Changes in the power or shape of your vision? I have been feeling a bit anxious lately, but nothing major. No changes in my vision either. Any changes in your appetite or weight? My appetite has increased, and I've noticed some weight loss. Do you feel your heartbeat? Sometimes feel aware of my heartbeat. Any diarrhea or constipation? No issues with bowel movements. Any irregularities in menstruation? My periods have been irregular lately. Intolerance to hot or cold weather? I do feel intolerant to hot weather. 3. Trauma. Past medical and surgical history. Any previous episodes similar to this? Any other medical problems or surgeries in the past? No previous episodes, but I do have a family history of thyroid cancer. I haven't had any surgeries before. Do you take any medication? Any allergies to medications? I don't take any medication regularly, and I'm not allergic to anything. Social history. Do you mind personal questions? No, doctor, that's fine. What is your job? And who do you live with? I work as a teacher, and I live with my husband and 2 children. Do you smoke or drink alcohol? I don't smoke, but I do have an occasional glass of wine. Idea, concern, and expectations. Before we go any further, what do you think might cause these symptoms? What concerns you the most about your condition? What do you hope we can do for you? I'm worried it could be something serious like thyroid cancer, especially with my family history. I'm hoping we can figure out what's going on and get it treated. Systemic review. Start from head to toe to make it easy. Do you have a headache? No. Have you experienced any chest pain or shortness of breath recently? No, I haven't. Have you had any cough or wheezing? No, I haven't had any cough or wheezing. Are you experiencing any stomach pain? No, doc. Have you noticed any changes in your urine? No. Are you experiencing any joint pains, muscle aches, or stiffness? No. Mrs. Sarah, have you observed any rashes, itching, or unusual changes in your skin? My skin has been normal without any rashes, itching, or unusual changes. Thanks, Sarah. We'll need to conduct further investigations. Thank you, doctor. I appreciate your help. Of course, Sarah. We'll work together to get to the bottom of this and get you the treatment you need. Discussion. Present your patient. I took a clinical history from Sarah Johnson, a 36-year-old teacher. She presents with a gradually enlarging neck lump over the past year, associated with recent discomfort, difficulty swallowing, increased appetite, weight loss, and irregular periods. No history of trauma or previous similar episodes, but with a family history of thyroid cancer. So my main diagnosis is toxic multinodular goiter. Also, I will consider thyroid neoplasm, simple multinodular goiter thyroiditis. How will you investigate this patient? I will do triple assessment approach, including thorough clinical examination, imaging, US, biopsy for confirmation. What else? Thyroid function tests, TSH, T4, T3 levels. Radioisotope scan calcitonin levels to further evaluate the thyroid gland. Do you think a CT scan is necessary? Considering Sarah's symptoms primarily indicate hyperthyroidism without obstructive features, a CT scan may not provide additional valuable information at this stage unless we suspect complications or other underlying conditions. What are the causes of sudden thyroid enlargement? Hemorrhage inside a cyst, malignant transformation of nodules within the gland. Further imaging and biopsy would be needed to confirm the diagnosis. How will you treat your patient? Medical treatment. Antithyroid drugs, such as carbimazole or propylthiouracil beta blockers, to manage symptoms. Radioactive iodine therapy. Consider if there's no significant response to medical therapy. Surgical intervention, thyroidectomy. Indications. Failed medical treatment in cases of thyrotoxicosis. Suspicion of thyroid neoplasm. Presence of obstructive symptoms. Cosmetic concerns. How will you counsel your patient before doing thyroidectomy? I will tell the patient about general risks associated with surgery related to anesthesia, hypotension, esophageal ulceration, allergy, etc. wound, healing issues, delay healing specific complications, injury to the recurrent laryngeal nerve, hoarseness or aphonia, risk of hypocalcemia, lifelong thyroxine dependence.
Thank you, doctor. That's all. You can proceed to the next station.